So we're just showing you a nice pelleting procedure for female, and how simple and easy it is and painless, literally. So first we just start off literally draping the patient, like making a field where it's going to be comfortable for her. Everyone just drapes it differently. I just kind of focus on making sure that, you know, I'm not getting anything on her. And then I have my pellets here already. And everything is within this clean field. So I'm just opening everything up. And then I'm prepping the site that I'm going to treat here. I'm just gonna have the patient tilt over a little bit. Wiping with alcohol first. And she's been pelleted previously. And I'm just wiping the area again. And this is your chloropleth. Again, keeping it within this field. And now I've extracted my lidocaine, 1% lidocaine prior, and then also I'm attaching the needle too. And this is we're just numbing process. So this may sting a little bit, but again, I always give heads up to the patient, and also it's a quick. So one quick little tap, and we make a little bolus, and then we kind of go up in like a nice 30-degree angle. And I just like doing the tap because it's like a nice little distraction. And the patients tend to appreciate it. One less thing that they have to feel or think about. And then we're going to give that a little bit of time to kind of numb and set in, and then proceed on with the pelleting. Okay, so now the patient has, you know, been numbing for a little bit of time. So I just like to clean the site again with the core prep, just to prep again. And then I'm going to just test her to see how she's doing. Do you feel anything?
No.
So again, with my tapping, just to make a nice little incision. There we go. And then I'm going to put this here onto the side because I'm not going to use it again. I'm going to get my trocar device. And I'm going to insert the trocar in at a nice little, you know, 45-30-degree angle, because I want to be into that subcutaneous fat, because that's where the pellets are going to sit. As you can see, the patient, you know, is comfortable. She's not jumping because, again, she's, you know, thoroughly numbed. And then this is the other piece of the trocar, which helps with pushing the pellets in place. Oh, sorry. And then I'm going to start putting in my pellets. So we have our estrogen, which is the smallest one. I like to start with that first. And I push that into place. Then I'm going to add my testosterone. 25 milligrams of that. And I'm just rotating just to make sure I'm getting into the placement. Same thing. Another 25 milligrams testosterone. The patient's getting 150 of testosterone, 10 milligrams of estrogen. And this is for her. Because remember, the dosing is individualized. So what she's getting is not going to be the same thing that someone else is getting. So, and that's it. And now I'm just basically going to apply betadine to the site so that way I can put my steri strip on, and that way it stays nice and secure. My steri strip, I'm just going to dab that again. I can be a little excessive with the steri strip, so forgive me. I just like to make sure that it's nice and covered. I'm going to put the gauze on this side on top of it, just to provide that support. Well, absorption, obviously, of any, you know, residual fluids that come out. My Tegaderm, which is going to stay on for at least 24 to 48 hours. unless it's causing her irritation, because I want the site to heal properly, because it's going to heal from inside out. And then I like to apply pressure for at least a minute at least, just to make sure that everything's clotted, she's not bleeding, things like that. And it's very comfortable. I'm just putting a nice firm pressure. And that's it in a nutshell. So essentially the patient, she's going to leave here. She can still do her everyday activities. The only thing that we remind them is the restrictions of making sure that, they keep the dressing on for at least 2 to 3 days, making sure that they're not sitting in a hot tub or anything like that, just obviously to minimize risk of infection, making sure that in terms of physical activity, again, we tell the patient for at least 3 days not to do any lower body exercises or aggressive exercises such as lunges, climbing trees, like whatever, you know what I mean? And essentially, after that, she can go about her business. It's not taking away from anything if she has to go to work, go shopping, or even on a trip. These are things that are basic. It's seamless. No one else is going to know that she's had it done because it's, nicely tucked away in her booty, But aside from that, this is it. It's a quick, simple procedure that you can get done every 3 to 4 months, and you're just in and out. So on that note, have a great day.